Good afternoon, dear patients. Today we will discuss a case shown in the picture, which is a urethral stricture. It is quite difficult to photograph a urethral stricture because they are not often visible from the outside. They are more often found inside the urethra, but in this case it is exactly that kind of situation. The patient has been noticing this kind of whitening of the lips, as he calls them, of the urethra for a long time. Basically, it is caused, among other things, by the sticking together of the urethral lips in the morning. Signs of inflammation and discharge are visible. Accordingly, in the morning, these lips are quite difficult to separate under the influence of urine. There were even cases when the patient would manually separate the urethral lips himself using a special vegetable oil, and so on. In other words, this was a significant problem. In addition, this patient had fatty deposits in the urethral area and some other inflammatory symptoms. Accordingly, the patient first underwent tests, a general urine analysis, a smear for flora, a bacterial culture, and tests for the main sexually transmitted infections. As a result of the examination, the first finding was leukocytosis in the urethral smear, about 15 to 20. Ureaplasma was found in the urethral smear. In general, a concentration analysis was not performed, since leukocytosis was already present. This was in principle suspected from the very beginning, because there were slight discharges and adhesions. Let me remind those who read a lot on the internet and claim that ureaplasma does not need to be treated. The main indication for treating ureaplasma is not only its concentration, but also the presence of inflammation. In this case, there was inflammation in the genitourinary organs that was visible even externally, and it was also present in the smear. Accordingly, in this case, there was no doubt that ureaplasma needed to be treated. And secondly, the Staphylococcus aureus count was 10 to the 6th power, which is also not normal. Therefore, the Staphylococcus was treated according to its antibiotic sensitivity, and the pathogenic ureaplasma as well. The course of antibiotics lasted accordingly 10 days. In addition to this, there were instillations into the anterior urethra performed with collargol solutions. Also used were drugs like longidasa, injectable antibiotics in micrometabolized form, and accordingly immune medications such as cycloferon. As a result of this treatment, the patient's inflammatory symptoms disappeared. Follow-up tests were taken, including a bacterial culture, PCR analysis for mycoplasma, and a smear for inflammation, all of which came back normal. For such patients, it is indicated that after the inflammatory symptoms have been resolved, after directly elimination of pathogens, in our case ureaplasma, since there were no bacterial pathogens, shows that firstly, urethral bougienage is performed using these bougies. This is the largest one, with the diameter gradually increasing. And accordingly, if there is involvement specifically of the external opening of the urethra, the patient undergoes a meatotomy. What is a meatotomy? It is an incision of the urethra at the front, and this enlarges the opening in the urethra. A small incision is made and sutures are applied. The most important thing here is to use various devices, for example, a terasan or a bougie, so that the opening does not close up again after such an incision, which is exactly what was done for this patient. The patient was kept under observation, and both externally and according to the patient's own feelings, the urethral opening became wider. As I mentioned, the pathogens were eliminated, the meatotomy was performed, and the urethral opening widened, so that the lips do not stick together, which completely satisfies this patient. Accordingly, considering that this patient had suffered from such a condition for quite a long time, it would of course be interesting to observe the initial stage and possibly treat it. And these infectious inflammations might not have occurred at all, and it might have been possible to avoid even such a minor procedure as bougienage and so on, and perhaps the condition would not have developed. That very urethral stricture that you see in the picture. Therefore, at the very first signs of inflammatory or other changes in the genitourinary organs, it is necessary to consult a doctor.